Well, and we have some other Manitoba news here as
Yes.
well. And speaking of kind of tying it in with the Church Under Fire documentary as well, this one comes from Global News, where a Manitoba Court of Appeal has dismissed churches' challenge to COVID-19 rules. So the appeal court says a Court of King's Bench judge did not err in his analysis that the restrictions were necessary to prevent the spread of COVID-19 and allowable under the Charter of Rights and Freedoms. Lawyers for the churches argued public health orders in 2020 and 2021 that temporarily closed in-person religious services, then permitted them with caps on attendance, violated the charter. And that's really what happened throughout the COVID hysteria, and infringements on the charter are allowed. I think it's section 1 in there, but they have to be demonstrably justified. And still to this day, I would argue that these restrictions were never demonstrably justified. They were never based in science or evidence, and they completely disregarded all of the previously well-established pandemic response plans that are in place from 4 times. Why we still don't have those answers, right? Why was that? How are they getting away with it? And when will the courts finally address that situation?
Well, and the one thing we're not even talking about is the effectiveness. We have absolutely no evidence that any of this was effective. In fact, we have evidence to the contrary, that these infringements on civil liberties and people's ability to travel or to gather, to worship, to associate, we have no evidence that any of the restrictions on those things prevented the spread of COVID-19. We have no evidence. In fact, we might have some evidence to the contrary, that they were absolutely ineffective, and that cloistering people in their homes probably contributed to the spread and to negative outcomes on the health impacts of people and to the psychological impacts of people. So I don't know how we can continue to say that judges have not erred, that politicians have not erred, because the evidence continues to roll in that none of this stuff was actually effective. None of it mitigated anything else, and it was all for naught. And nobody's ever going to apologize for it, but could we quit persecuting the people who were wise enough to say, none of this makes any sense, I'm not doing it? But no, we continue to persecute those people. Anyway.
And well, I just pulled up an article quickly, and there was one that was a bit closer to home. But this one comes from Australia, which we saw. I guess Australia was a little bit more totalitarian in their response than we were here in Canada. But yeah, it says that there's a wide range of collateral damage from the COVID lockdowns. And so these were harms. Lockdowns likely caused more harm than benefit, it says, with wide-ranging damage that will be felt for years to come, a grim new study has found. And that's interesting because the studies are just starting to roll out. We had no idea, because this wasn't based in science or evidence, what these restrictions, what the fallout of these restrictions would be. And so now we can finally start to study it and see, especially on children, the social isolation and the masking, the inability to see faces, to recognize emotions, to learn oral development. That I think will have a ricochet effect for potentially generations to come. And so now we can finally start to track and trace that, because we have no data to go on prior to 2020. Because like I mentioned, all of those previously well-established pandemic response plans were completely disavowed for knee-jerk hysterical reactions.
I think there's also some sinister reasons for why they were so coercive with the vaccine mandates. And it's not because they truly believed in the effectiveness of the vaccines, because evidence is rolling out, like redacted documents are starting to roll out, that as early as 2021, they knew that the vaccine effectiveness was not all that they were telling us it was. In fact, if I recall correctly, I had documents from the Canadian government that says they tested for safety, but not necessarily effectiveness. They were taking the manufacturer's word on the effectiveness, and Health Canada really didn't care all that much. They just wanted to make sure that they didn't kill you if they stuck this thing in your arm. And I guess that remains to be seen for some people. But I think that's why they wanted to eliminate those control groups. Places like Lacrete, Alberta, that's way at the top of the province. It's at the end of the highway and very far from Edmonton and difficult to get to. It's easier to fly into Lacrete than it is to drive. That town never closed. Never closed. They never forced anybody to adopt a vaccine if they wanted to. They refused to impose a vaccine mandate on their municipal facilities. Churches never limited restrictions. The restaurants never closed. If you wanted to close, fine. They weren't going to make you stay open. But they said all of this stuff is optional. And you know what? You want us to do it, come and get us and make us. In fact, the municipal government stopped oil and gas companies from operating within the Mackenzie County jurisdiction if they had a vaccine mandate. And Mackenzie County is like the size of Belgium and a couple of other countries. Like, it's huge and it's oil and gas rich. And they said, forget it. You're not coming. The moral of the story here is we must protect little places like Lacrete because they were proof positive that everybody else got it wrong and they got it right. They reached herd immunity way faster. They didn't have a mass casualty event. And they protected civil liberties. People could deal with COVID however they wanted without the coercion of the state because there was no state coercion. And because of that, we can see who actually wanted a vaccine versus who took one as an inoculation against travel restrictions, self-isolation, and unemployment. And their vaccine uptake was in and around 30%. So if you didn't coerce people, that's the true number of people who actually wanted them. So I think that's why the travel restrictions and the vaccine mandates were so harsh, is because the powers that be, I really believe, wanted to eliminate the control groups so that there was nothing to prove how wrong they were against. There's no measure if you get rid of the control group. So anyways, thanks to Little Lacrete. You're the control group.
That sounds amazing. Maybe I need to look into a relocation there. We had a small business actually here, and everyone was labeled as a super spreader if they didn't uphold the COVID hysteria and the diktats from the COVID regime. And there was one garden center locally in Cobourg that had nothing. They didn't do the signage. They didn't do the plexiglass shields, that ended up finding that they hindered the airflow instead of prevented any sort of spread or viral transfer through the droplets. And it was really, truly like stepping back into time. And so I frequented that garden center and still will prioritize business to them over anywhere else, simply because they were just said, hard line in the sand. Nope, we're not doing it. And there was never any excess deaths tied to them. They were never targeted by public health. They just silently continued on as they were always, and they're fine. They didn't do anything. And so it's interesting to see that, there was never a breakout or a super spreader event tied back to this garden center because they didn't have stop COVID-19 signs on their doors.
They didn't make you walk that one direction on the floor because COVID only goes, I guess, counterclockwise. I'm not sure how that works. Just on the flip side of this, some good news that we saw yesterday. I wrote it up for the website. It's a TDF victory that maybe some courts might be moving in the direction of allowing people to argue that, hey, actually, this wasn't all that effective. So we've got an Ontario doctor who was suspended because he didn't comply with the 2021 vaccine mandate. He had his hospital privileges suspended by the Chatham-Kent Health Alliance. And so he's won the right to appeal. He's a surgical assistant. So I guess that makes him more dangerous, I guess, because he could be breathing into the wound, apparently, according to these people. But right now, he's allowed to argue about the efficacy of vaccines in preventing the transmission of COVID-19. So I guess this is the actually, I told you so, and I was right argument that the judge is now allowing him to make before the appeals board of his, wherein he's appealing the suspension. So he's going to be able to argue about the efficacy of vaccines as to whether or not the vaccine policy was reasonable at the time that they suspended his privileges. So this is good news. I think this is the first time I've actually ever seen somebody now being allowed to say, actually, you guys were wrong. Hindsight is proving me right. And you don't get to continue to punish me because I saw something you didn't see, which now everybody else might see.
It's just so unfortunate that the wheels of justice are so slow turning, right? This is 2 years and he's just going to the Court of Appeal, and it'll be, I don't know, I imagine at least 6 months before it's heard and then a decision is rendered. And in order to get precedents, it just takes so long. And that's the really unfortunate unfolding of all of this, is that we can institute these knee-jerk reactions on a whim without any evidence and just implement them full speed ahead at the snap of a finger, but then to try to fight back and oppose it and say it was unconstitutional or it was unwarranted or unjustified, well, sorry, it's going to take you at least 3 years to do that. Yeah. So that's really where a lot of the injustice is. And the, what do they say? The crime is in the sentence, or what's that saying there? I have it wrong.
The process is the punishment. The process is the punishment. You get put through the ringer for 2 years just to prove that you actually did nothing wrong. And before we move on, because we need to do an ad break, and then we're not even going to get close to touching on all these topics. But I just want to give a shout out to the Democracy Fund, the hardworking lawyers at the Democracy Fund, because I think this victory would not be possible without them taking on this case at no cost to this doctor. Because the Democracy Fund is, I think at this point, Canada's largest civil liberties charity. And they work on civil liberties litigation, but also education. But shout out to all the people who continue to donate to the Democracy Fund, because without you and your tax-deductible donations to the Democracy Fund, these small victories are not possible. And, you know, it might seem like a small victory, but this changes the entire world for this doctor who just wants to go to work and make people healthy. And it has a knock-on effect on other cases. So you got to win the small ones to change the entire system. And that's what our friends at the Democracy Fund are doing. So kudos to the Democracy Fund and kudos to the donors to the Democracy Fund. This one's on you.
Hey folks, that was a clip from the Daily Roundup. That is our live stream show that airs from 1 to 2 p.m. Eastern Standard Time, Monday to Friday. I'm usually here for 4 of the shows. Our Alberta team takes over on Fridays. And you know what? You can interact with the hosts. If you give us a small financial donation, we'll read your comment during the live stream. So please go to revelnews.com/livestream and tune in Monday to Friday at 1 p.m. Eastern.